You know those machines you see in movies, in the intensive care units, that are breathing for people? They can look pretty intimidating, right? Well, today we're going to pull back the curtain on them. Let's dive into this explainer on mechanical ventilation and see it for what it truly is. Not some scary machine, but an incredible, life-saving bridge that gets people back to breathing on their own. I mean, really think about that for a second. It's such a basic, fundamental fear, and for a very good reason. Breathing is life. But what happens when your body just can't do that job anymore? Well, that's when technology has to step in. And that's really the starting point for our whole story today, that critical moment when help is needed most. And you know, it really is that simple and that profound. This quote just cuts right through all the medical jargon. The core mission, the entire purpose of a ventilator is to take over the work of breathing. That's it. It gives the body the time and the support it needs to heal. It's like a temporary partner in a really critical fight. So when exactly is this partnership needed? I mean, our breathing system is incredibly tough, but sometimes it just gets completely overwhelmed. Let's take a look at the kinds of things that can actually lead to what's called respiratory failure. Okay, so the reasons really fall into two big camps. On one hand, you've got direct attacks on the lungs themselves. We're talking about things like a really bad case of pneumonia, a major flare-up of a chronic lung condition like COPD, or something called ARDS, which is basically a massive inflammatory response in the lungs. But here's the thing, it's not always about the lungs. On the other hand, something totally different, like a serious head injury or a drug overdose, can mess with the brain's command center that tells the body to breathe. Even after a huge surgery, a ventilator might be needed for support. In every single one of these cases, the end result is the same. The body just can't get the oxygen it desperately needs. And that, right there, brings us to the machine itself. When the body can't do the job, the ventilator steps up. So let's get into what this machine is actually built to accomplish for a patient. So here's the official definition. It's a machine that handles the whole process. It pushes oxygen-rich air in, and then it allows the waste gas, carbon dioxide, to get out. And it can do this in two ways. It can either assist a patient's own weak breaths, giving them a little help, or it can take complete control if they can't breathe at all. It's an incredibly powerful and precise tool. Now, to really get what its mission is, this slide has the perfect mnemonic: oxygen. It breaks down all the goals so perfectly. First, it's all about improving oxygenation and enhancing gas exchange. You know, getting the good stuff in and the bad stuff out. Then it decreases the patient's why work of breathing, which can be absolutely exhausting when you're sick. And it gives the lungs a much-needed break so they can heal. And finally, it helps eliminate CO2 and normalize the patient's blood gases, which tells doctors exactly how well the whole process is working. Every single one of these is a critical step to getting that patient stable. All right, so we get the why and the what, but how? How does a machine replicate something as natural as taking a breath? Well, it's actually a pretty brilliant engineered four-part cycle. All you have to do is remember the word TICE. First up is the T trigger. Something has to kick off the breath. It could be the machine's internal timer, or, in a better scenario, the patient's own small effort to take a breath. Next is I for inspiration. That's the machine delivering that perfectly measured breath into the lungs. Then comes C, the cycle, which is just the signal to switch from breathing in to breathing out. And finally, E for expiration, where the body just passively lets all that carbon dioxide out. TICE. Every single breath follows that exact pattern, over and over again. And this table really shows how that cycle is managed in different ways. See, there's not just one setting. In assist control, or AC, the machine is pretty much in charge. It guarantees a set number of breaths, no matter what. That's usually where things start. Then there's SIMV, where the patient and the machine start working together. It's more of a partnership, and you see it a lot when someone's getting stronger. And finally, pressure support. This is where the patient starts every single breath, and the machine just gives them a little boost of pressure to make it easier. The mode is always tailored to exactly what the patient needs at that moment. Okay, so let's keep going. Being on a ventilator is obviously a huge life-saving thing, but it's not without its complexities. It takes constant attention, super precise settings, and a real awareness of the potential challenges that can pop up. Let's just focus on one of these key settings. It's called PEEP. Okay, I want you to picture the tiny little air sacs in your lungs, the alveoli, as millions of microscopic balloons. Now, when you breathe out, they can get sticky and collapse. PEEP is a tiny bit of continuous pressure, usually around 5 centimeters of water, that keeps those little balloons from deflating all the way. It makes that next breath so much easier to take and makes a huge difference in oxygen levels. So yeah, this one little number has a massive impact. Now, because mechanical ventilation isn't a natural process, the medical team is always on the lookout for potential complications. And they generally fall into these four main buckets: issues with the lungs themselves, effects on the heart and circulation, the risk of infection, and problems with the breathing tube. So for example, even though that pressure is saving a life, too much of it can actually injure the delicate lung tissue. That's a risk called barotrauma. All that pressure in the chest can also affect how blood flows back to the heart, which can sometimes cause low blood pressure. And of course, since there's a tube going straight into the lungs, bypassing all the body's natural filters, there's a serious risk of something called ventilator-associated pneumonia, or VAP. And we can't forget the human side. Being unable to speak, feeling that total loss of control, it can lead to intense anxiety or delirium. And this is exactly why the care team is so important. And that brings us to the final, and honestly the most hopeful part of this whole journey: the incredible human care that surrounds the technology, and of course, the ultimate goal: getting that person breathing all on their own again. Look, a patient on a ventilator is never just a person connected to a machine. They are the absolute center of a storm of constant, focused human care. You've got a whole team of nurses, doctors, and therapists there 24/7. And they aren't just checking settings. They're meticulously cleaning the patient's mouth every couple of hours to prevent pneumonia. They're repositioning them to protect their skin. They're watching every single vital sign like a hawk. And maybe the most important thing of all, for a person who can't speak, they are a lifeline. They explain what's happening, they offer reassurance, and they preserve a person's dignity when they are at their most vulnerable. And every single one of those actions, all of that moment-to-moment care, is leading to this one goal: weaning. This isn't like flipping a switch. It's a slow, careful, gradual process of dialing back the support, testing the patient's own lung strength, and building up their confidence. For the patient, the family, and the care team, it's a huge series of hopeful steps on that bridge back to recovery. So in the end, that's exactly what a ventilator is: a temporary bridge. It's a piece of technology that carries a person through a terrifying time when they just can't carry themselves. It is not the destination. Which kind of leaves us with one last question to think about. As our technology gets even smarter, what does the future of this incredible life-saving bridge even look like?